Now we are being joined by Dr. Bishwajeet Elangbam, who was one of the first doctors in India to be trained in emergency medicine. He is currently a consultant in Sandwell and West Birmingham NHS Trust. Birmingham is the second worst affected city with the Covid-19 pandemic in the UK. Good evening and welcome. Now you have seen people suffering with this new virus, Covid-19, since day one in your hospital. Can you please share with us your experiences since the first positive cases were reported and then the resulting casualties?
I think what we heard about the news about in Wuhan in China about the outbreak of this pandemic, and it was, I believe, on the 27th of January that we had our first testing of our masks. So we were preparing ourselves by making sure we got masks that were fitted to our face. And I still remember when in the first week of February, we did some simulation for our department and how to look after patients. One of the first things what we did was we had what we call as a coronavirus pods. So these are areas in the emergency department, but not inside the emergency department, where we can see patients and assess them with the hope of not contacting anyone in the hospital. And it was on the 10th of February that I saw my first patient over there, who was a suspected COVID infection, but it was not, and the person had traveled recently from China to Hong Kong, but it was not from Wuhan directly. Then it took a while for us, because we were seeing a lot of patients who were suspected COVID, but not confirmed positive. The first positive one came on the 5th of March for Birmingham, and for my hospital on the 14th of March. And now we are on the last week of April, and in the last 6 weeks, things have changed a lot in the last 6 weeks. What I do understand is, from the data I have, we possibly, I think, have around 250 unfortunate deaths in our hospital, which is very, very sad. Of which 170 were confirmed to be COVID positive. So that's a lot of patients in the last 6-7 weeks that's come through our hospital. So yeah, and it was because I have been in part of the team that were involved in looking after patients during the SARS period. We thought, okay, we should be okay, but we were worried as the mortality, as the number of deaths increased in Wuhan as well as in Italy. So even though we had the preparation, we had the experience as myself from that time, there were a lot of apprehension during my colleagues and my staffs and my colleagues in the hospital, people especially who had joined the hospital recently. So it's a bit of a somber affair of looking into how things were at the end of January or beginning of February, and then how it has turned out in the last 8-9 weeks in UK, especially in Birmingham.
Doctor, as you know, India is now moving towards a critical stage. What would your advice or best practices that should be followed in healthcare sectors for the public?
I think I saw in the news in India yesterday that the curves have sort of flattened. So the number of cases in Delhi has come down, the number of cases in Gujarat has come down. In Manipur, for example, there is no confirmed positive cases now. The 2 cases have recovered. So my suggestion, my advice to the public is, the government has given strict advice of what to do. All right. Please remember that the lockdown is to buy time. I keep repeating this again and again. All right. The lockdown is to buy time. The virus will come one way or the other. All right. Until there is a vaccine developed, until we can prevent it. The vaccine is the way to prevent it. Otherwise, one or other, we will get infected.